The Health Minister Dr Zweli Mkhize, he's been on that tour of the two Gauteng hospitals, the Tshwane District Hospital and the Steve Biko Academic Hospital. Linda Mnisi is there for us. Linda, good afternoon to you. You saw the Minister speaking just a moment ago. How would you sum up his message about the situation at those hospitals?
Well, Stephen, I can barely hear you, but I can tell you the Minister doing a walkabout here at the Steve Biko Academic Hospital. But you'll also remember that this hospital is a complex hospital since the Tshwane District Hospital was turned into a full COVID hospital. So the Minister doing a walkabout in both hospitals, going to the other side of the Tshwane District hospital. Also quite important, you remember just a couple of weeks ago, I'm going to ask to do just a short walkabout. They don't allow us really to be walking around in this area, particularly because it's really high risk, Stephen. Images coming out of social media here showing us, people that were sleeping here, depicting perhaps how severe the situation, how dire the situation was. But today we're seeing a completely different picture. You'll remember the Premier was also here, just 2 weeks ago to check on the state. But the Minister also speaking to us, telling us that perhaps things are a bit better. They're going to be prioritizing rapid testing to, help with the time or the turnaround time so that more people don't get to spend time here. But I'm just going to move into the CEO of the hospital. She's currently taking a couple of questions from the media. Let's just listen in.
The nurses, have they already started?
Yes.
The 4 doctors and the nurses?
The nurses and doctors, two doctors started. And nurses have started, yeah.
And the dietitian as well?
The dietitian hasn't started.
Okay. And the tents still at 2, or did you add more?
We added, no, it's 2 that has been there all along.
Yes.
We have added 2 in the past 2 weeks.
Past 2 weeks. Thank you, Sir.
Let's talk about the issue around the rapid testing. The Minister saying that, it's one of the things that need to be prioritized in order not to have a situation here that we saw a couple of weeks ago. How far is that?
The rapid test is readily available with the National Health Laboratory Services. But all along, up to now, in this facility, we have been using it for staff, to test staff, rapid tests. And the National Health Laboratory Services is training people that will also conduct it for patients. But in addition to that, the MEC of Health and the Premier have deployed the mobile testing that were being put at the entrances. We can say boundaries where people were entering our province, to screen people there, to do the rapid tests there for highly suspected people. Those mobile units are going to be moved to our respective facilities. Those facilities that have got higher pressures, they are going to receive those so that we do the test immediately. And then only those patients that we are not sure their tests are going to be taken further to the laboratory. So that will help.
The Department of Health 2 weeks ago confirming to us that some of the patients that come to this hospital are patients from Mpumalanga, Limpopo and the Northwest. Are you seeing more and more, or has the numbers decreased from other provinces?
The numbers, we are known as a COVID hospital. We are one of the designated hospitals, and to the public, if they know you are rendering the service, unlike going to where they'll find out and they will be told you don't, I think that is my thinking, they prefer to go where it is known that COVID-19 services are rendered. We are still seeing patients coming from all over, but the patients are not only coming for COVID-19 to us. It's a norm that they will move from their various provinces to seek assistance, and also the foreign nationals that are coming for the same assistance.
We heard one of the employees speaking about the issue around PPEs. Are you seeing, is it an issue for this hospital?
It has never been an issue. It's still not an issue. We have PPE. Like I did say, maybe it's a matter of preference. If I need a product of that company and the employer provides a different product, I may take it as not an acceptable PPE for myself. But we must say we are comfortable, and we again presented to the minister what we have in our stores for PPE.
All right, there you have it, Stephen. That is the CEO of this hospital, painting a rather different picture from what we saw. Still getting numbers from different provinces, as you may know. Just 2 weeks ago, we heard from the Provincial Department of Health in Gauteng telling us that, some of the people that are coming to this hospital are people that are coming from other provinces like Limpopo, the Northwest, and of course Mpumalanga. But of course, the CEO there telling us that, people really come here because they know that this is one of the designated COVID-19 hospitals. So it seems at this point, the hospital is, of course, managing and has been able to really deal with the situation here at the Triage area.
Linda Mnisi, thanks very much indeed. Really do appreciate that. All right, well, that's the centre of some of the action this afternoon. We're right there for that. The Health Minister saw the CEO of that hospital explaining the situation in that institution.